The patient is currently on Cinemat 2 pills 4 times daily, and we need to be considerate of the on and off times and time the treatment session accordingly. She is also taking trazodone for insomnia. So during treatment, we should be considerate of possible decreases in alertness, cognitive ability, balance, coordination, anything like that. The 3 outcome measures I chose were gait analysis, focusing on the decreased arm swing, and then the tug to tug cognitive difference, because there was a greater than 10% decrease in the two, indicating that she has reduced dual task capacity. I chose both of those because some of the patient's goals and main concerns were centered around gait. I also chose lower extremity weakness as a focus point, again, because this could potentially affect gait endurance and efficiency, as well as affecting any daily tasks that the patient wants to get to specifically. The specific neuroplasticity principles I used were salience, specificity, and intensity or dosage. And so I chose to build the interventions around her specific goals. And like I mentioned earlier, I chose outcomes that were focused around getting in and out of, or up and down out of her garden, walking around the community, things like that. And the interventions were targeting those specific deficits. And then again, with the intensity, I chose to maintain levels at a moderate to high intensity or an RPE for the patient. 2 personal contextual factors would be the patient's medications. As I mentioned previously, those would just be a bigger consideration for treatment timing and planning. And then of course, just remaining mindful that her performance or outcome of intervention could highly be influenced by the medications that she is taking, and we need to consider the timing accordingly. The other personal contextual factor that I chose was her supportive husband and her safe home environment. Those were 2 things that she was very proud of and she felt very confident in, and those would just be very encouraging to her overall adherence to the intervention and to the skilled therapy sessions. I would say that the most difficult decision was finding out how to narrow down the interventions to target a specific deficit that also had correlation to her specific goals and to tasks that she found meaningful. Just pairing the 2 and finding out how I can make that tailored to the patient specific with her in mind, with her best interest in mind. And then the least confident part of the plan, I would say, is the length and frequency of intervention. She is in, I would say, chronic stage. She's had it for a few years and she has been in and out of physical therapy. And at this stage, I know that it would be best for her to receive continuous care throughout the remainder of her life, specifically with the gait, according to the sources. And so I'm not too sure. It would definitely be dependent on that day, like the day of the evaluation, what I find and what I see, and then of course insurance and what they authorize for the amount of visits. But I know typically it can range from 4 weeks to 12 weeks, and so given that my patient has been living with Parkinson's, I chose to go with the longer term of 12 weeks. Again, specifically keeping the gait training in mind.